Hello everyone. This is our second video and I just wanted to start off by wishing you all health, safety and well-being on behalf of all of us here at Ellerslie Dental Studio. In this video I wanted to speak with you all about acute jaw joint and muscle pain. This is a condition that can develop due to either excessive clenching or grinding, which is something many of us are doing right now, or due to traumatic injury. When it happens, it can be quite alarming because it's sudden and quite painful. So one of the things that many people are uncertain about is whether to use cold or hot and how to initially treat these kinds of things until they can receive further care. So I'm going to speak to that today. The main thing is in the first 48 hours, you want to reduce inflammation, and the way that we do that is with cold. So what we suggest is using a cold pack, using it 3 times a day, and generally we suggest applying cold to the joint and or the muscle for 5 minutes on and 5 minutes off for about a half an hour, and to repeat that 3 times a day. An anti-inflammatory medication is also very important at this point, whether it's Advil, so ibuprofen, or something longer acting like Aleve, which is naproxen. Besides those things, a soft food diet is also very, very important for the first 2 to 3 days. And a little pro tip is when you have to yawn, to gently rest your tongue against the roof of your mouth so that you don't hyperextend your jaw and re-injure yourself. So after those first 48 hours, then the goal becomes to reestablish circulation and normal range of motion. So what we tend to suggest after the first 48 hours is to begin applying heat. And when you apply heat, the same regimen applies, applying a hot pack to the jaw joint or jaw muscle or both for 5 minutes on, 5 minutes off for 30 minutes at a time, 3 times a day. You'll also want to do some light jaw stretching after having applied heat to the muscles. So holding the jaw open for 5 seconds and then closing and then repeating 3 times. Besides that, there are medications that can be used at this stage as well, an anti-inflammatory such as Advil or Aleve, and a muscle relaxant like Robaxacet actually helps quite a bit at this stage as well. Another pro tip is at this stage you can use Voltaren gel, which is a diclofenac non-steroidal anti-inflammatory gel. This is something that is very effective in treating jaw joint and muscle pain, but it needs to be used again at least 3 times a day in order for enough of it to be absorbed to be effective. Diclofenac gel or Voltaren gel is helpful for people who can't deal with the gastrointestinal issues that can develop from being on anti-inflammatory medications like Advil or Aleve for prolonged periods of time. So hopefully that clarifies a little bit about when to use cold, when to use hot, and what types of medications you can use when you suffer from an acute jaw injury or sudden pain. Of course, if these home remedies don't help or your symptoms progress, then please feel free to reach out to me and I will be happy to help you from there and to figure out next steps. So that's it for this week. Thank you all for watching, and till next time.